Good day. Today, we're going to perform the procedure, which is obtaining an electrocardiogram. The purpose of this is to identify the radiant disturbances, conduction, abnormalities, and electrolyte imbalance. It also gives information about the size of the heart's chamber and the heart's position in the chest. This also aids in diagnosing and monitoring such conditions as MI and pericarditis. This procedure can also monitor the effects of medication and evaluate the function of an artificial pacemaker. For the equipment, we need an ECG machine, an ECG strip or paper, an electrode with gel, a 4x4 gauze pad. For the assessment, we need to review the patient's medical record and plan of care for the information about the patient's need for ECG. Next, we need to assess the cardiac status. Next, we need to keep the patients away from the objects that might cause electrical interference. And lastly, we need to inspect the patient's chest for areas of irritation, breakdown, or excessive hair.
For planning, verify the order for an ECG on the patient's medical record. And then, gather all the equipment needed and bring along the bedside. Next, perform hand hygiene and put on PPE if indicated. Next, identify the patient. Good afternoon, sir. What is your name? Okay, sir. And then, close the curtain around the bed and close the door to the room. If possible, as you set up the machine, record a 12 lead ECG and explain the procedure to the patient. Tell the patient the test records of the heart's electrical activity and it may be repeated to a certain interval. Also, explain the procedure to the patient. So, good afternoon, sir. Today, we're going to perform obtaining an electrocardiogram. This will give you information about the size of your heart's chambers and the heart's position in the chest. It also can monitor the effects of medication and evaluate the functions of an artificial pacemaker. Next, place the ECG machine close to the patient's bed and plug the power cord into the wall. Next, if the bed is adjustable, raise it to comfortable working position. For implementation, have the patient lie in supine position in the center of the bed with the arms at the sides. Raise the head of the bed if necessary to promote comfort. Expose the patient's arms and legs and drape the patient appropriately. Next, select the flat, fleshy areas on which to place the electrodes. Avoid muscular and bony areas. If the patient has an amputated limb, choose a site on the stump. Third, if an area is excessively hairy, clip the hair and do not shave it. Clean the excessive oil and other substances from the skin with soap and water and dry it completely. Next, apply the limb lead electrodes. Next, connect the limb lead to the electrodes and make sure that the metal parts of the electrodes are clean and bright. Expose the patient's chest and apply the precordial lead electrodes. Next, the position of each lead should be number 1, V1, fourth intercostal space at the right sternal border. V2, fourth intercostal space at the left sternal border. V3, halfway between V2 and V4. V4, fifth intercostal space at the left midclavicular line. V5, fifth intercostal space at the anterior axillary line, halfway the V4 and V6. Next, connect the precardial lead wires to the electrodes. Make sure that the metal parts of the electrodes are clean and bright. And then after the application of each lead, make sure that the paper speed selector is set. The machine is set to the full voltage. Next, if necessary, enter the appropriate patient's identification data into the machine. Next, ask the patient to relax and breathe normally. Instruct the patient to lie still and do not talk while you record the ECG. Sir, could you relax and breathe normally? And you should, sir, lie still and do not talk while I record your ECG. Next, press the auto button. Observe the tracing quality. Next, when the machine finishes recording all the 12 leads ECG, remove the electrodes and clean the patient's skin if necessary with adhesive remover for sticky residue. After disconnecting the lead wires from the electrodes, dispose all the electrodes and return the patient in a comfortable position. Lower the bed height and adjust the bed to a comfortable position. And then drape the patient. Next, clean the ECG machine per facility policy. If not done electronically from the data entered into the machine, label the ECG with the patient's name, date and birth, location, date and time of recording, and other relevant information such as symptoms that occurred during the recording. Next, remove additional PPE if used and perform hand hygiene. Next, for evaluation, note for the quality of ECG obtained. For documentation, secure the ECG strip to the chart. Document the patient's name and the date and time of ECG is obtained.